Well, hello. On behalf of the Epilepsy Foundation of Wisconsin, I'd like to welcome you to this virtual meetup. Today, the focus of our conversation is the ketogenic diet and epilepsy and seizures. For this meeting, we're thankful to be joined by neurologist Dr. Elizabeth Felton and clinical nutritionist Kelly Faltersack, both of the University of Wisconsin Hospitals and Clinics. My name is John Mirasola. I'm the Client Support Services Coordinator from the Foundation. I've worn a lot of hats here, but I've been around since about 2013. Just a quick note about us. The foundation, the Epilepsy Foundation of Wisconsin, is an affiliate of the National Epilepsy Foundation of America. We've been around since the early 80s, and we serve many purposes. However, one thing I want to make clear, we are not a medical agency. We're a human services agency. So any questions that you might have regarding medical issues, you should really take right to your neurologist, or in the case of today, a clinical nutritionist, given what we're talking about. Okay. Dr. Felton, could you say a few words about yourself?
Sure. So my name is Elizabeth Felton, and I'm a neurologist that also has subspecialty training in epilepsy. And one of my special interests is the use of dietary therapies for the treatment of epilepsy. I've been at UW Health for about 4.5 years, and shortly after I came, I helped start the adult epilepsy dietary therapy clinic, which has really just been growing since then, and I'm excited to talk to you more about it today.
Great. And Kelly, how about you?
Hi, I'm Kelly Faltersack. I'm a registered dietitian nutritionist at UW Health. I work in the neuro ICU, and I work in the adult epilepsy dietary therapy clinic with Dr. Felton. So I specialize in the ketogenic diet.
Excellent. Well, thank you both. Well, let's dive right in then. There are a lot of special diets out there today. There's diets for athletes, vegetarian diets, vegan diets, lots of weight loss diets as well. The ketogenic diet is, of course, its objective is epilepsy reduction of seizures. Can you give us a general overview of how it relates to epilepsy, how it works per se? Dr. Felton, if you could comment a few things about that.
Sure, I'd love to chat about that. So although there are a lot of special diets out there, the ketogenic diet is particularly unique because of how long it's been around and how long it's been proven to reduce seizures in people living with epilepsy. So hundreds of years ago, scientists first realized that fasting or not eating for prolonged periods led to seizure reduction. When you're not fasting, the body's using carbohydrates or glucose from our standard diet for energy. But when in the fasting state, it goes to its fat stores for energy, and the liver can process that fat, make ketone bodies, and the body gets into this state we call ketosis, which leads to seizure reduction. Scientists in the early 1900s discovered that instead of having people fast or essentially starve, you can mimic this state by having people eat a very high-fat, low-carbohydrate diet. So that way of eating is called the ketogenic diet, and that term or phrase was first coined in 1921, so almost 100 years ago. And it basically leads to seizure reduction in a much more sustainable, sort of long-term way than fasting. So essentially the ketogenic diet is a high-fat, low-carbohydrate, moderate protein diet, or as Kelly, I'm sure, would love to talk about, we actually prefer to call it a medical nutrition therapy because it's not really a diet in the way that that in our society we call diets. In terms of how it works, the exact mechanism is still unknown. So, whoever discovers that will probably be very rich in some way. There are a lot of scientists that are working on that from both a basic and clinical research perspective. It probably works through multiple pathways, though. And I think that, hopefully in our lifetime, we'll understand better how it works. But right now, it's unclear.
Terrific. It's interesting history. I didn't realize it went back 100 years. So.
Yeah, it's incredible.
Kelly, is anything you'd like to add to that?
No, she covered it very thoroughly.
All right. Well, Kelly, then the next one's directed at you. So tell us what are some of the obvious and maybe not so obvious foods a person would eat if they're following this diet?
Yes, so typical foods that are allowed on a ketogenic diet would be things like meat, eggs, some dairy products, low-carb vegetables, berries, and lots of fat, like avocados, healthy oils, nuts, nut butter, seeds, things like that. I think some of the not so obvious things that might surprise people are that you can make a low carb version of just about anything. We actually offer free keto cooking classes for our patients to help teach them more about low carbohydrate cooking. We've made everything from low carb breads to pizza, pancakes, waffles, desserts, mac and cheese, zucchini noodles. So it's really awesome that you can make a low carb version of everything. You just have to change the ingredients you're using. For example, instead of using flour, we would use almond flour or coconut flour. And instead of using sugar, we would use low carb keto friendly sweeteners. So our goal is always just to make the ketogenic diet sustainable for people. So we like to offer lots of resources and recipes.
Interesting. Well, just as a follow-up to that, how strict does this diet have to be adhered to? Do you get like a cheat day or anything like that?
Well, as Dr. Felton mentioned, I really don't like the word diet. It implies that this is something that you can start and stop or cheat on, or that you should feel deprived in some way. And that is not at all our goal. I always call it a medical nutrition therapy. It needs to be treated the same way that you treat your medications. You wouldn't skip a dose of your medication, so you shouldn't cheat on the diet, because being knocked out of ketosis could trigger a seizure the same way that missing a dose of your medication could trigger a seizure. So like I said, our goal is to make the diet as sustainable as possible so that people don't feel the need to cheat, and to provide all those resources to help people be successful.
Okay. If you are knocked out of ketosis, just as another quick follow-up, how long could it take to get back in?
It can take a couple of days to get back in. Usually people that are on the diet for a long period of time are what's called keto adapted. So they might be able to get back into ketosis a lot faster. We've had patients that are able to quickly get back into ketosis. But for people who are starting the diet and haven't been on a ketogenic diet in the past, it can take a couple of days to like a week to get into ketosis, depending on how strictly they're following the diet.
Okay. Thank you. Now, the mainstay of the ketogenic diet is, of course, fat. We know that. But I understand there's some differences between how children work the diet and how adults work the diet. Am I right on that?
Yes.
So
There's several different versions of the diet. The version of the diet that's typically used in children is called the classic ketogenic diet. This version of the diet is typically prescribed in macronutrient ratios. It's usually 4-to-1 ratio for children, and that means that a child must eat 4 grams of fat for every 1 gram of protein plus carbohydrate. About 90% of calories from the diet are coming from fat, and all foods have to be weighed very carefully on a gram scale. In comparison, the version of the diet that we use for adults is called the modified Atkins diet, and this version of the diet can also be used in children, and so children have different options besides just that classic ketogenic diet. But the key is that normal household measurements can be used instead of weighing foods on a gram scale. We focus more on carbohydrate counting, and patients limit their net carbohydrates to 10 to 20 grams of net carbs per day. About 65% of calories are coming from fat, 30% from protein, and 5% from carbohydrates. The goal from both of these diets is to get into nutritional ketosis.
Okay. Dr. Felton, anything you'd like to add to that?
No, I think Kelly covered it. I think my only comment, your original question was about the foods, and I think people don't realize how delicious the foods can really be. A lot of people have this perception from maybe things that they had heard 1 or 2 decades ago, maybe, adults who maybe have had epilepsy their whole life and had heard about it when they were a child and heard that it involves eating sticks of butter and shots of oil and things like that. And it really has evolved so much over the years, and the foods are so palatable and delicious. And so I think that the fear of the foods shouldn't be any type of barrier to somebody giving it a try.
Okay.
And Kelly works extra hard to give, to come up with wonderful recipes for our patients to try.
Yeah, I believe I've seen some recipe cards, and I think they're almost uncountable. So,
Yeah.
Kelly, you do a terrific job with that.
Thank you.
Right there with you. Okay, well, as of today, as of right now, can you maybe explain how this diet is known to work in terms of success, the success rates? How well is it working right now? Dr. Felton, if you could comment.
Sure. So I think the scientific literature has been fairly consistent with this, like we call it the efficacy data, or how well the ketogenic diet improves seizures in people with epilepsy. So of course, some studies show better or worse outcomes, but in general, about half or 50% of patients have a 50% or greater seizure reduction, and about 10% are seizure free. Now, there's a couple caveats when you hear those numbers that I think are worth pointing out. So one is that the majority of patients in research studies on ketogenic diets historically have been people with intractable epilepsy, meaning that they've tried and failed at least 2 seizure medications and are still having seizures. The reality is that most of those people in those studies probably have tried 4, 5, 6 medications, may have had surgery, may have had VNS or RNS, and are still having seizures, and then tried the ketogenic diet. And so those statistics, the 50% having 50% or greater seizure reduction and 10% seizure free, are actually very good in that type of population. So once you've tried and failed 2 medications, the chance of getting those type of outcomes with the 3rd medication or 4th medication is basically slim to none. So I feel that it's a really good treatment to try, and possibly will have better chance at getting seizure reduction than trying yet another medication. The other caveat that I want to point out about those numbers is that it does not capture improvements in seizure severity. So we've definitely had patients who, just throwing an example out there, they have 4 generalized tonic-clonic seizures per month. And then they start a ketogenic diet, and now they're having 4 auras per month. And so auras are what we call focal aware seizures. They are seizures. So they are still having 4 seizures a month before and after. So that would be 0% seizure reduction. But I think we would all agree that that's a significant improvement in seizure severity, quality of life, less injuries, things like that. So those numbers don't capture that. And we certainly have a lot of patients who have enjoyed fairly significant improvement in the severity of their seizures.
So with your patient roster, you've been pleased of what's happened so far, or am I?
Oh, definitely. Yeah. I mean, we've had some wonderful success stories with our patients in terms of people that were not able to work due to their seizures, going to full-time employment, people who were not able to drive because of their seizures, who get that 90-day in Wisconsin seizure-free mark and are able to get their license, all sorts of improvements in quality of life. So it's really been fantastic for many of our patients.
All right, great. Now, if you could just comment, what type of a patient would be maybe best suited for it? What kinds of things do you look for? What type of patient do we, maybe the best success rate? So.
Yeah, so in my opinion, the ketogenic diet should be offered to any patient with epilepsy. There are a few contraindications. Those are typically metabolic conditions that are diagnosed in childhood. And then there are a few conditions for which the ketogenic diet is actually the standard of care. So like GLUT1 deficiency syndrome, ketogenic diet is standard of care. But for most types of epilepsy, the ketogenic diet can work well. In terms of what specific type of patient we're looking for, I've really learned to not make too many judgments about that in advance. We've had many patients who just, I thought, oh, I'm not so sure if they're going to be able to do this, and they do awesome. Similarly, I've had patients who I've said, oh, they're going to really do well, and then they haven't. And so I think Kelly and I have learned to really just keep a very open mind to the patients that come to us, and we've had some great success with all different types of patients. If your question is more, is there a specific type of epilepsy that it works better in than others? There are some studies that show some slight things like that, but not in any significant way. So focal epilepsy, generalized epilepsy, epilepsy from, related to a tumor, related to some sort of trauma like a car accident or something that somebody was born with, it can help in patients with any of those types of epilepsy.
Okay, well, thank you. Now, many health magazines, health food magazines, especially for the last few years, they have really been displaying the ketogenic diet as the best new diet for weight loss. Aside from epilepsy, was this one of its most fundamental uses? Kelly, if you could comment.
It's funny that people call it a new diet. It's funny that they're doing it for weight loss, because as Dr. Felton mentioned, the diet has been around for 100 years, so there's nothing new about it. And the other thing that's interesting is that we consider weight loss to be a side effect. It was originally developed for people with epilepsy. And, for some patients, weight loss is a desired side effect, and it can be really motivating to lose weight and also have benefit in terms of seizures. And for other patients, weight loss is not desired. So for those patients, we provide strategies to help them maintain their weight and prevent weight loss. In terms of the ketogenic diet as a diet for weight loss, I think it's really important to weigh the risks and benefits. There are potential side effects that can occur, and we don't know the long-term risks since there's not a lot of data on the long-term use of ketogenic diets. So if someone is looking to lose 5 or 10 pounds, the potential unknown risks might not be worth the benefit. But if someone needs to lose 50 pounds and they're looking to reverse their type 2 diabetes, then the benefit may outweigh the risk. I think the most important thing is that people need to make sure they're working with their healthcare provider to monitor for side effects, and that this diet should only be done under medical supervision from qualified professionals who have an in-depth knowledge of the ketogenic diet.
Okay, so just to clarify, weight loss is not a guarantee with this at all. Am I right there?
If you want it to happen, it usually does. But, everyone is different, and it kind of depends on a lot of factors. It happens for a lot of our patients, but it doesn't happen for all patients.
Okay, great. Dr. Felton, anything else you'd like to add to that?
I think maybe it would be helpful, to give some examples of why medical supervision is so important. So, and this would be for somebody starting a ketogenic diet, whether they or not they have epilepsy. So for example, if someone has hypertension or high blood pressure and they're taking medications for that and they lose weight, like we just talked about, their blood pressure might actually improve. And so they will likely need an adjustment in their blood pressure medication. So we really encourage our patients that are taking those type of medications to work with their primary care provider on that, to make sure that they're checking their blood pressure. Of course, we check their blood pressure when they come to our clinic, because if you get low blood pressure, that can cause some symptoms. Another example would be, Kelly had mentioned that it can help with diabetes also. And so if people are on insulin for diabetes before starting a ketogenic diet, we may need to adjust the amount of insulin that they're taking. Well, I wouldn't be, but the person who is managing their medications for diabetes would do that. Or even patients that are taking oral medications for diabetes, a lot of times they would be able to lower the doses of those. But again, if a person with diabetes is taking too much insulin or oral anti-hypoglycemic or hypoglycemic medications, they could have hypoglycemia or low blood sugar, which can cause symptoms and problems. And so that's why it's so important for it to be medically supervised. And so we strongly recommend against people starting it on their own. We always check lab work before a person starts. We also screen them for a lot of potential contraindications or things that we might need to watch a little bit more carefully. If needed, we'll coordinate with their primary care provider. And then we check labs and things at regular intervals while they're on the medical nutrition therapy.
Okay. Well, in terms of a basic overview, that about wraps it up. For questions, would either of you like to touch on anything we missed? Dr. Felton?
No, I think we covered it all. I think it was a good summary.
And Kelly?
I agree. Nothing to add.
Okay. All right. Well, to those of you watching this right now, just a couple of quick notes. If you'd like to submit a question or offer some feedback, you can do that through our email. It's one option, and that is connect, CONNECT, at epilepsywisconsin.org. I'd like to also encourage you to follow us on Facebook. Our Facebook handle is Epilepsy Foundation of Wisconsin. And check out our website as well. We have other educational materials as well as recordings and webinars, and we'll definitely be adding more. We'll delve a little bit deeper into the ketogenic diet probably at some point in the future. So, keep in touch with us. And our website is epilepsywisconsin.org, one word, epilepsywisconsin.org. Well, Dr. Felton and Kelly, thank you very much for your time. We know you're both very busy people. And to those of you watching this, thanks for joining. Come back again.
Thank you.